AI lending a hand to dentists. Or maybe an eye is a better way to put it. We're taking a deep dive into some research, all about how deep learning can be used to identify something super tiny on dental x-rays, something called the mental foramen.
Yeah, pretty interesting stuff. And to be clear, it's not about replacing dentists or anything like that. It's about giving them a really precise new tool.
It is really wild when you think about how AI can be used for something as precise as, like, dentistry. So
Mhm.
tell me, what is this mental foramen thing? Why do dentists even need to find it?
So picture a tiny little opening in your jawbone. Doesn't sound like much, right?
Right.
But turns out it's really important. Like if you're getting an implant or a wisdom tooth pulled, they got to make sure they don't miss it.
And I'm guessing missing it is not good.
Not good at all. You could hit a nerve, blood vessel, all sorts of things you don't want touched.
Yeah, no thanks. So how does AI even play into all of this? Are we talking about robots doing surgery now?
Not quite robots. This research used a bunch of different deep learning models to find this mental foramen on those panoramic x-rays, the ones that spin all the way around your head. These models are basically computer programs trained to see and understand those images.
Okay, so like teaching a computer to be able to look at an x-ray just like a dentist would.
Yeah, exactly. But instead of years of school, it's fed tons and tons of data. In this case, they used 702 panoramic x-rays, and each one of those was paired with a mask. Basically, imagine someone highlighted the exact spot on the x-ray where the mental foramen is.
Ah, so they're basically outlining Waldo for the AI to help it learn.
You got it. And by learning from all these examples, the AI starts to pick up on the patterns, the little visual cues that say, hey, the foramen is right here.
That's so interesting. Did they find that the shape of the highlighting mattered? Like if they used a circle versus a square?
You'd think it would, wouldn't you? But here's the thing, the models did really well with both shapes. It didn't seem to matter. Shows you how good they are at picking up on those visual cues.
That's wild. So it wasn't just memorizing shapes, it was understanding the underlying structure.
Yeah.
Which of these AI models ended up being the best at finding Waldo, or I guess the foramen?
The one that really stood out was called UNet. This particular model is known for being really good at segmenting images, which means it's good at picking out specific objects or features, so it makes sense that it would be so good at this.
UNet, got it. And it's so fascinating how a model designed for image analysis can be so good at something so specific. Makes you wonder what else this could be used for, not just identifying this one thing, but maybe even changing how these procedures are done.
Oh, absolutely, and that's where it gets even more interesting. Imagine if dentists could use this as a second opinion, or even as a way to guide their instruments during a procedure.
It's like having a second pair of eyes, but incredibly precise eyes. That could change everything, especially for those more complicated cases.
Exactly.
I'm curious, how did the other models do? Were there any that came close to UNet?
There were a couple of others that showed some real promise. ResUNet plus plus, for example. There are a couple of others that showed some real promise. ResUNet plus, for example, that one also had really good results. Basically, it's kind of like an upgraded version of that UNet we were talking about, but it uses something called residual connections.
Residual connections. I don't think I've heard of that before.
So imagine you're trying to get a message through this really long, winding tunnel, right? Residual connections are like little shortcuts built right into the walls of that tunnel. They let information travel through a more direct path. So for this ResUNet plus plus thing, those connections help it learn way faster, even with more complex images.
So it's like giving the AI a faster path to process all that information, which makes sense because those x-rays are pretty complicated. What about that other one you mentioned, the one with attention in the name? Did that one use those shortcuts too?
That one, UNet attention, that one's really interesting. It's almost like it's trying to think like a human would. Think about it this way. If you lost your keys, you're not going to stare at every single object in your house with the same focus, right?
Right. You probably look where you usually keep them first.
Exactly. And that's what UNet attention is doing. It's focusing on the areas of the X-ray where the mental foramen is most likely to be instead of wasting time on every single pixel.
Wow, so it's like giving the AI a way to prioritize. That's amazing.
It is. And this whole idea of mimicking how our brains work, that's becoming a really big thing in AI research.
Well, it makes you realize how much we can still learn from ourselves as we build these really advanced AIs. So going back to this study, how do we even know these models are accurate? They didn't just like feed them images and call it a day, did they?
Oh, no, no, there's a lot more to it than that. They actually use something called cross-validation, which is a way to make sure their findings were legit and not just a fluke.
Class validation, what is that? Some kind of AI obstacle course?
Kind of. Think of it like training for a marathon. You wouldn't just run on a treadmill the whole time, would you?
No, you'd want to train on different terrains and stuff.
Exactly. You want to experience all kinds of different conditions to be ready for anything. That's what cross-validation does for AI. It splits the data up into chunks and trains the model on some of them, then tests it on the rest, the ones it hasn't seen before.
So it's making sure the AI can handle any X-ray you throw at it.
Yep. And because that UNet model did a good job across all those different chunks of data, it gives us a much better idea that it would work in the real world with brand new X-rays too.
That makes me feel a lot better about the accuracy. But I'm sure every study has its limits. What did the researchers say were the limitations of theirs?
One of the big ones they pointed out was the size of the data set. 702 images might sound like a lot, but in the world of deep learning, it's still pretty small.
So they need way more data from all different kinds of places to really be sure these models would work everywhere.
Exactly. Different populations, different equipment, even just different image quality, all of that can affect how well it works.
That makes sense, but also getting that much data from a field as specialized as dentistry, that's got to be a challenge.
Definitely a challenge, especially when you have to think about patient privacy and all of that. But it's super important to get those big, diverse data sets if you want to train AI models that are really reliable.
It sounds like AI in dentistry is still in the very early stages, like we're just getting started.
Yeah, for sure. But this research, it gives us a pretty good idea of what the future might hold. AI could really change the game when it comes to how accurate and how efficient dental care can be.
Okay, so it's definitely something to keep an eye on. We've talked about how this could be good, but I'm curious about the bigger picture. What does this research tell us about AI in all of healthcare, not just dentistry?
That's a great question, and it's something that's a great question, and it really gets to the heart of why this research is so exciting. It's not just about dentistry, it's about what AI can do when you need that superhuman level of precision and detail.
Yeah, it feels like we're just scratching the surface of what's possible.
Totally. Think about all the other areas of medicine where analyzing images is so important. Like, what if you could use AI to look for tiny fractures in bones?
Look, why?
Or early signs of cancer in mammograms, or even problems with the eye, like from diabetes.
It's almost like having this AI superpower that can see things even the best doctors might miss.
Exactly. And it's not just about catching things earlier, it can help with treatment, too. Imagine AI helping doctors plan out exactly where to target radiation for cancer, or helping a surgeon map out a really complex procedure.
It's like AI could help us move toward this future of personalized medicine where everything is tailored to you.
Right. Fewer side effects, better outcomes, all because the treatment is designed for you and your body.
It's kind of mind-blowing when you think about how far we've come in such a short time. We started with this tiny thing, the mental foramen, and now we're talking about revolutionizing all of healthcare.
It is pretty amazing, and I think it shows how we're not just building AI, we're kind of learning and evolving together. As we teach these AIs to see the world like we do, we're also learning more about how our own brains work.
It's like we're both the student and the teacher. That's a pretty cool way to think about it.
It really is, and it's what makes this whole field so exciting. We're not just building machines, we're pushing the boundaries of what's possible for technology A&D for ourselves.
I like that. Well, this has been a fascinating deep dive. Not just informative, but really inspiring to think about the future of AI in healthcare. Thanks for joining me on this one, and for everyone listening, until next time, keep those minds curious.